Okay.
Okay, today I'm doing the types of mange in dogs. So what is mange? It's a mammalian skin disease that's caused by mites that presents with irritation and itching, hair loss, and scabs or open wounds. And there are 4 different common types that can occur, and they're Demodectic, Sarcoptic, Chaliteosis, and ear mites. So how to diagnose mange? Your veterinarian usually will use skin scraping to collect samples to examine under a microscope. And what the scraping does is it allows for the collection of mites that are living on the skin, as well as getting some of the mites that may be living in the hair follicles to come up towards the top, so you can get the ones living underneath as well. You can use blood work and stool samples to examine, as well as other panels can be run, because sometimes mite infestations are caused by an underlying condition such as autoimmune diseases or things like that. So the first one is Demodectic mange, and it's caused by an infestation of Demodex canis mites on the skin, and this is also called red mange or puppy mange, and it is caused by just a number of Demodex mites above the normal amounts that are commonly found on the skin, because these are mites that normally live on the dog's skin and eat the dead skin and things like that, but sometimes they will overpopulate and cause things such as hair loss and other things like that. It's seen in a lot of young dogs or dogs that are older and have immunocompromised bodies, but it's not contagious, but it has been found to be hereditary, and a lot of breeders actually try to breed against it. If they find a dog that has this Demodectic mange, they try to take it out of their breeding program because it can cause problems later on. And the symptoms include loss of hair in patches. With normal looking skin like this one, it just kind of looks like white skin underneath. And it's mild itching. And then you can also have widespread hair loss, which causes severe itching, and it shows obviously red and irritated skin with scabbing or scaling and sores. So Demodectic mange continued. I don't know why I did that. But skin scraping is used to detect abnormal mite numbers in this. And mild cases can actually resolve without treatment. So once the dog's immune system kind of recovers or it gets back to normal, they will clear up on their own. But antibiotics and dips or skin ointments can also be used to rid the skin of mites more quickly. Things such as gibberellin ointment, benzoyl peroxide, amitraz dips, ivermectin, which is found in Heartgard, and milbemectin oxime, which is found in Interceptor, which also works to prevent heartworms, can work to decrease the number of mites on the skin. And then immunocompromising issues also need to be treated to take care of these issues as well, otherwise they're just going to keep coming back. So Sarcoptic mange, which is also called scabies, which is what people normally hear it be called, is caused by an infection of Sarcoptes scabies, which is actually closely related to a spider. The females have a life cycle of 17 to 21 days, and they'll burrow into the skin and lay eggs, which hatch within 3 to 10 days, so you kind of have to keep retreating it until you kill the eggs, as well as the females that are living on the skin. It's highly contagious with people and cats, also at risk of infection when they come into direct contact. So it's characterized by an extreme irritation with red, scaly skin, which is what you see here, and it's going from sparsely haired areas, so things such as the muzzle or the ears, and then it kind of spreads to the whole entire body and just turns into real large scabs. Skin scraping is used to diagnose this as well, but then they also use clinical signs and responses to treatments that they do, just because dogs can react to such minute concentrations of this mite that it may show up false negative if skin scraping is done, because there may not be any in that little area that you're testing. Dips, injections, oral medication, and spot treatments are used to combat this nasty mite. Breed and health have to be taken into account, because some medicines that you can use for this are good for some breeds but not good for others, so your veterinarian will tell you which is good and which isn't. Scabs and other irritations are removed with a bath and medicated shampoo, followed by a dip in amitraz or lime sulfur 3 to 4 times, like I said, to combat that life cycle of the eggs and the females. And then all pets should be treated due to the contagious nature of these mites, and all bedding should be washed and treated with an insecticide, because they'll just continue to stay in your house if you don't take care of the whole problem. Chalateosis, or walking dandruff, is just this little white, it looks like dandruff, but they move across the skin and you can actually see them moving. And they're called Chalatea, and they live on that top layer of skin, and they will also collect in human hair as well. So if you have other like animals living in the house, or you yourself, you need to be real careful because you can get this as well. Symptoms include that flakiness and scaling of the skin and itching. Treatment includes topical ointment, injections, oral medication, and flea preventatives, such as lime sulfur, amitraz, ivermectin, revolution, and imidacloprid. And all exposed pets, again, in bedding should be washed and treated. And with this, you can also, since they're a lot like fleas, you can actually use flea bombs and sprays to help get rid of them as well. Ear mites, or Demodectic cyanotus mites, infect the ear and the external flap of the ear, and then they can be passed on to other animals that way. Symptoms include sensitivity of the ear, head tilting, head shaking, increased scratching of the ear, an unpleasant odor, and that dark buildup inside of the ear cavity, which is what causes that unpleasant odor. Treatments include cleaning the ear cavity and placing a liquid medication directly into the dog's ears, and it's normally Tresiderm is what veterinarians will give to combat this mite.
And you're ready for questions?
Yep.
Questions from the audience? I had a question, I guess, on the first mite you talked about. It's normally on the integument, right? Remember the first one?
Yeah, Demodectic.
Demodectic. So
what that is like this puppy right here actually is one that has it.
Okay.
It normally affects the eye area, or areas that don't have a ton of hair on them.
Okay.
And what it is puppies have immunocompromised immune systems anyway until...
So a normal immune system keeps them in check,
yeah,
basically.
And basically, like, they'll die off. But
Yeah.
if they're immunocompromised, they can just keep feeding.
But so a normal healthy dog would have some of those mites on there in a small population.
Yeah.
Right?
Mm-hmm.
Yeah.
And then if there's a sickness or something going on, then they can sometimes build up.
Yeah.
And on top of the sickness, they also get skin issues because they can't combat that mite
Right.
that's feeding off of them.
And then you made a good point about how all drugs that are used for dogs or chemicals can't be used on all breeds.
Yeah.
I like that because ivermectin, I'm a border collie person. No ivermectin. What are the other breeds that can't have ivermectin? Somebody help me on that. Isn't it the Australian Shepherds too? Anybody know for sure? Because I know for sure the border collies, I think it's dogs like that can't have ivermectin. I know border collies can't, and I thought maybe Australian Shepherds, but I'm not sure.
Why
But
not?
never assume, huh?
I said, why not?
It's toxic, like the ivermectin, I think what it is, and that's a little questionable on my part, I think they can't metabolize it like other dogs, so it builds up, it's more toxic to them. A lot of times if something's toxic to one animal and not the other, it's because of the rate of metabolism and stuff. But that's a good point. I can't remember exactly why ivermectin, if it's something genetic.
It's genetic.
Okay, that's what I thought. Tell me, could you explain further?
Multiple resistance.
Say that louder, what?
Like the multiple resistance gene, like collies and other dogs have, like Australian Shepherds.
Oh, okay.
They have the genes and just makes it.
Right, and you know, that, when I do those DNA kits on the dogs, they check for that. Yes, okay, good. I'll have to go back and review that. It's the, what is it, MDR, did you say? What is the?
multiple resistance.
Yeah, I know, multiple drug resistance. But on those DNA kits I do, they come back and say yes or no if they have the genes for that. Yeah, multiple drug resistance, right? Yeah. Very interesting. And then another thing is, never assume what you can put on a dog, you can put on a cat, right? There's all this stuff. Yes?